Good afternoon, folks. This is Holly Lemaster with the Colorado MESA Initiative. Welcome to our webinar on living with dementia, a patient's perspective. And we will get started today with just a couple of housekeeping items. First of all, if you can hear me, if you would raise your little hand-raising icon just to make sure that we're coming through loud and clear. That helps us. Great. I see some hands going up, so I appreciate that. There's information on the screen. Oh, we've got the peanut gallery here. Just wait. We've got a room full of folks here, and they're goofing off already, raising their hands. If you're having issues, you can always use your telephone versus your computer, and the information about it is there. You can type any questions in throughout the session into your Q&A box there on your control panel, and we will be addressing all of those at the end. Everybody's muted in the meanwhile. And this webinar will be archived on the Colorado MESA Initiative website on Monday. And you no longer need to log in to get to the classroom section on the website. We have opened that all up to the public. So just go to coloradomesa.org, go to the classroom and the webinars, and you'll be able to watch it again and share it with your colleagues, etc. I'd also like to remind you that there are many other archived webinars on really fantastic topics, so browse around a little bit and take advantage of that while you're there. The Colorado MESA Initiative is a grant-funded project. We have been generously funded by the Colorado Health Foundation primarily, and also by the Kaiser Permanente Foundation and Caring for Colorado. And we are actually doing our last official webinar of the MESA Initiative today. We have been working on this project since 2009. We have had 2 very generous rounds of funding and lots of support from the Colorado Health Foundation. We've been all throughout the state of Colorado. We've seen more than 1,500 folks in our live workshops. We've done more than 100 workshops, so mostly primary care providers and other folks that are involved in taking care of Medicare patients primarily. So we want to thank everyone who's participated throughout this time. It's been really fantastic. And we do have a new home for the MESA Initiative. It is going to be hosted by Colorado Access, which, if you're not familiar with it, is a health plan for underserved Coloradans. If you want to check it out, their website is coaccess.com. And I believe what's going to happen is all of the materials on our website will stay there, and then we're anticipating that we will do quarterly updates and maybe a webinar once a quarter or so. Dr. Don Murphy and I will be working on that. So we would love to have you continue to keep track of what's going on, and we want to keep you up to date on what's happening in the Medicare world. So today's program features Amelia Shafer, who is the Director of Professional Education for the Alzheimer's Association Colorado chapter. Amelia's worked with Alzheimer's both here in Colorado and in Oregon for the past 13 years, and her job is to primarily train the healthcare professionals with regard to Alzheimer's disease and other forms of dementia. She works with medical students, residents, doctors, etc. And Amelia, hello, welcome.
Hi, Holly, thank you.
Would you like to introduce our special guest today?
Yes, I am pleased to let you know that the real expert in the room today is Mr. Lionel Syme, and he's graciously volunteered his time to come and talk about what it's like to live with dementia, and primarily to really give people the understanding of the last 4 years of his life when he was diagnosed 4 years ago, and how he and his wife have handled the diagnosis, and some of the advice he gives to current physicians and will give to our physicians on the line here about how to treat their patients with dementia.
Beautiful. So why don't you, before you get started, tell us a little bit about the Alzheimer's Association and the services that you provide.
Sure. We're a nationwide organization, and our chapter here in Colorado provides programs and services all across the state of Colorado through our 7 offices. We have education programs, support groups, many programs for family members, people living with Alzheimer's or dementia, as well as health professionals. We also have a fantastic website and a 24-hour, 7-day-a-week helpline. And I know Holly has the
number appears here on the screen right now.
Absolutely.
Yeah.
And we also have another great tool for physicians, which is our rapid referral form. This is a great way to get in touch with us and to put us in touch with your families and patients right away. And so, there's a process where you fill out a form, you fax that to us, and we then proactively contact folks who might be of use for our services or might just need to know how to set up a plan for tackling this disease.
Mm-hmm. And you can get that form on the MESA website, or if you've been to one of our workshops, you've got the purple folder, and you would find the rapid referral form both in that purple folder and in the handout CD that we gave to you. So, and when you go to get that form, just a note, make sure you get the right one for your region. There are different forms for each region, and we want to make sure that it gets to the right place. So there again is the website and the 24-hour helpline number. So please avail yourself of these marvelous resources and share them with your patients and their family members. Okay, so Lionel, I know we've got a really long list of questions and interesting topics that we want to talk to you about today. So I'm going to click over here and turn on our webcam. Hopefully this will go just totally smoothly for us.
And Holly, I know that Lionel is open to answering questions that people watching this right now might have. So is there a chat box for them to type in questions?
There is, yes. Okay, our camera is up and running.
Great.
Cool. Everyone should be able to see you now. And if you have questions, just go ahead and type them into your Q&A box there, and we'll address those at the end.
Great.
All right.
Thank you, Lionel, for being here.
I appreciate the opportunity.
Yeah.
Can you hear me out there?
Yes.
Okay.
We can hear you.
So I wanted to start by asking you, what have been the things your doctor has done that have been helpful for you? What have your doctors done right?
Well, so I looked at the first doctor I visited, which was back on Cape Cod. We were living there at the time. The one thing that I appreciated was when I came to him and said I have dementia, I was having problems, he was willing to say, you have problems. And I've had other people that I've talked to, and they've started to have problems, and they have to continue to work for 2 to 3 years while those problems are happening. And so dementia is something that really affects a lot of areas of life, and if someone has it, it would be good to hear it from the doctor.
Mm-hmm. Yeah.
If we don't, then no. But
yeah, and we hear that often from many people who say, we've been trying to get the doctor to acknowledge this, but he or she hasn't done that. So hearing that from you is good
mm-hmm.
perspective.
And I would say my first doctor did the exact thing and sent me to a neurologist, and I was diagnosed with dementia when I did all of the social tests and the writing tests and everything else.
Mm-hmm.
So that next referral is really important.
So passing it on if you need more expertise, if you have that ability.
Mm-hmm.
Yeah. I'm curious if there's anything you wish your doctors would have done or things that they did that were not helpful for you.
First of all, I wish you guys had a cure for it.
Yeah.
And if I really looked at it, that I usually go to my doctor and I want to be fixed.
Yep.
And in this situation, I wasn't fixed. Quick fix would have been good. I would say that if a doctor looks at this disease, there's a lot of things about coping, and there's a lot of things about understanding that he probably doesn't have time to go through. But there's resources, and how do you get to those resources? And for me, the first Alzheimer's group I went to, I'll be honest, it was really a small one out on Cape Cod, and so the communication between the different people was pretty limited. I was more of a caregiver's side than something that would affect me. And I learned what not to do, just stress my wife out. So I've worked on that pretty hard.
Yeah.
But if there are, there's materials that would be useful. There's seminars that are useful. Maybe my background's technology, and so I knew how to get to things on the web, but when I went on the web, there's all kinds of information out there. And so if a doctor kind of has an idea of where I'm at, if he can provide me and my family with information. And that information is important to kids too. And so if there's information out there for grandkids or even kids, I mean, we have some people in our group now, they're in their 35 or 40s. I have younger onset Alzheimer's or dementia. And there's two couples there that are in their 40s. They have kids that are 5 and 6 years old. So
Oh my goodness.
have the information available that could pass on to those kids.
Well, and I appreciate that you acknowledge that all of that may not be able to happen in a doctor's visit,
Oh, yeah.
but that afterwards having the resources, knowing where to go, knowing who has the information, we're not all so tech savvy. And so that kind of referral is why we have the rapid referral program.
Mm-hmm.
Yeah. I also wanted to ask you, what do you wish your doctor would have said or done initially, or even now, about dementia, about living with dementia?
You know, during the first 6 months that after I was diagnosed, I lived back in Cape Cod. And we had moved back there because Terry had had a house. And we wanted to get rid of that house. I was working on the internet at that time. We wanted to get rid of that house. We didn't have big capital gains. We had to live there 2 years before we moved back. And so by the time, one of the things that my doctor did at that time, he had advised me you just got to live with it. Am I addressing something they did that made it more difficult?
Sure.
Okay. And he just advised me that you just got to live with it. And just living with it can be really frustrating because there's different kinds of dementia. There's different speeds at which it goes. And so I was out there learning on my own. And that can be very frustrating. And some people aren't computer savvy. Some people aren't, don't communicate to doctors effectively. And so they can feel very frustrated, but also kind of like there's a wall around them. And no one understands where I'm at. And I don't even understand where I'm at. So that's something I'd encourage. I mean, I have people in this group with me that are very, very frustrated with their diagnosis. And when I listen to them, it's because they're not getting good information. They're going from one thing to another, and as they do that, it can be putting them in a very frustrating position.
And the group you're referring to is one of the support groups for people with dementia, where the care partners meet in one room and the people with a diagnosis of dementia meet in another room. And I hear that you're quite a mentor to people who are newly diagnosed.
I just share.
You just share.
I'm not afraid to share. So.
Yeah, it makes a difference.
Lionel, is that an Alzheimer's Association group?
Yes, it is.
It is, yeah.
We meet monthly, and there's probably anymore. There's 21, 22 people with young, and they're all younger onset, so they're all people that were diagnosed, I think, before the 60s. And so that is a group that it has two sides that are pretty frustrating. One is you have all these plans in life, and those plans are really changed what you might want to do after retirement. The second thing is some of those people still have kids at home. And so to go through that change and lose an income has been a real life-changing thing for them. And support's so important to them.
Yeah, wow.
Yeah, makes a big difference.
It does.
Yeah. That's a great segue into, did any of your doctors do something or say something that helped living with this disease easier?
The first doctor did something that was really important to me, and that is he listened to me and considered what I said and then sent me to a neurologist. And so as a primary care physician, I have heard people within the group that talk about going through a year or 2 years of losing more and more cognitive ability and never getting to a neurologist so they have a diagnosis. We share, if you're younger, one reason why you want a diagnosis. If you have Alzheimer's, that's automatic for Social Security. And so you take a real load off of a family. If it's a real, I mean, I'm not saying make a fake diagnosis, but that diagnosis.
No, definitely not.
If the feelings are that person has some of the things and you think, well, I'm not sure, send them to a neurologist. Most of them have insurance. And at the neurologist, they do certain testing. I went through some psychological testing. And the decision was made by a neurologist, but my primary care physician took what I had and the information I gave him and said, yeah, I think I need to send them on.
Mm-hmm.
So don't be afraid to send them on. I have other people that, they don't, and so they find out why maybe it's stress, maybe it's something else. But
one of the questions that just brought up for me is that besides the Social Security issue, some people say, well, we don't have a cure for Alzheimer's or a lot of the other dementias, so what's the point of even getting a diagnosis? Are there other things you would say to that question besides the Social Security? Why even get a diagnosis? Why even try to find out?
If someone is coming to you, they probably have found it very frustrating at work if they're still in the workforce. They're finding it very frustrating at home because they cannot follow through on the things that they need to follow through on. I mean, for me, that's the biggest area of dementia is I can't do the things that I used to be able to do, and so I need to have a backup to be able to do them anymore. And that doesn't work in a job.
Right.
And so it adds a whole lot of stress during the time if you're waiting for a diagnosis.
Mm-hmm. And so even having someone say, this is not normal, even if they don't say, we know exactly what it is, if they say, we know this is not normal, that alleviates some of the stress of wondering, are you going crazy, or is that?
That is correct.
Yeah, and I've heard you say that before.
But if you look at it, and as a primary care physician, someone has dementia issues, then I'd encourage them to send them the next level up because that's really where the diagnosis is going to happen.
Okay. And then our last question before we get to any audience questions is, what are some daily living strategies that you think some of the physicians could give to their future patients with dementia? So daily living strategies.
I have found that the good old iPad and iPhone are two things that for me have worked out really well. I understand that for some other people it's a notebook that they carry with them. Yeah, and that's if I'm out and around. I print my last page of notes, so I have it with me what I'm supposed to be doing. It relieves stress in the family, and it allows the other person to feel that there's more trust that they don't have to be with you all the time. If you do the best job you can to stay up on things. So I've done two things. One is I hated Apple. It was one of the hardest things I ever did in my life. I worked for Cisco, the network company, and Apple was just a pain. They didn't fit in well. So I had to buy something that would do voice to text very well, and Apple has figured that out. And so I got an iPad, and then just about 4 months ago I got an iPhone. So I have notes. I have a calendar. I have every 2 hours I get a beep that tells me, look at your calendar, and I've forced myself to listen to those beeps even though I know what they're for, so that I can keep ahead so that Terry, for me it was relieving pressure from Terry.
Terry's your wife?
Terry's my wife. And so she knows that I have things that need to be done. Some of them are from me as a health-wise, and some of them are to help her still feel that she can work because it's a younger onset situation. Does that make sense?
That does, and you gave some great examples of the calendars, the notebook, whether it be digital or not, and also trying to find a way to alleviate some of the stress on your wife, which people don't always think about. People think, how can we alleviate your stress? But you're thinking, I want to help alleviate my wife's stress.
The reality is that at some point I don't have any stress. You know, and even now, if I'm not careful, it just flies right over my head. But this reminds me that I made a commitment.
That's great.
Every 2 hours for the day.
Yeah. Any other strategies that you wanted to mention? I know you were thinking about ways to help people with dementia that other health professionals can be a part of that helping team.
Well, one of the things that's happened in the last 3 months is my diagnosis has changed from Alzheimer's to dementia with ALS. I started having jerking in my arms, jerking my legs, jerking pretty soon all over my body. Started having weakness on my left foot. And I went to a doctor at the University Hospital. And it was a change because we had moved from kind of in this basic neighborhood, which is pretty close to the mountains, and we'd been going to a doctor out there. We moved out by the airport to a senior area. So when we made that move, we wanted to change doctors. It was too far to go out. And the first visit there, they looked at me and they said, I think you might have ALS. And when I came back, you know, in the end, we went to Mayo Clinic down in Scottsdale, and we came back, and everyone agreed I had ALS with dementia. And one of the things that they did they did a group doctor visit, which I think would be a great thing for Alzheimer's too. I met with a physical therapist, an occupational therapist, and a speech therapist, which are important in my disease. And then I met with my neurologist afterwards, and that happens every 4 months. So they keep track of the direction which I'm going. But the first time I went to visit him, the original doctor, the second visit, the neurologist was in the visit with us. So that ability to have a group, I think, would be important. I challenge doctors to think outside the box and say, how could I, with my group, end up with some other people involved that would maybe be helpful for this person? You probably only have 15 minutes to spend them with me in your office, and so that's a limitation you have. So how can you, as a doctor or a doctor's group, provide beyond just that you have dementia? Because that is a devastating thing to people. If you can provide some of the other parts that keep us running, social, how do I fit in, how do I take the limitations that I have and limit them so they don't affect who I am, I think are all important things. The other thing that I thought of, I had some of these questions before. Looking at my notes, sorry folks.
That's okay.
And the other thing that I was suggesting that maybe would be useful would be if you're at a point, and it might take something from the Alzheimer's Association too, if you're at a point where you're going to give a diagnosis that someone has Alzheimer's, there's couples here that have both sides. And if they could sit in on that meeting where you refer them to somebody and we would have that referral as a couple rather than an association, I think that we have people that would want to do that. And I think that that information that they could get from another couple adds to some important information. That's usually why we have groups, but a lot of times the groups aren't together. But a couple coming and meeting with someone would be very useful.
Yeah, and we do have ways of connecting people even beyond support groups.
Yeah.
And I think one last thing you shared with me before we get to any questions is that even though your original diagnosis was Alzheimer's, partially because your father was diagnosed with Alzheimer's 20 plus years ago, you said you want your physicians to be open to the possibility that something else may be happening, so that 2, 3, 4 years in, you know, someone raises a flag and says, I'm not sure that what we originally thought is true. So I appreciated that you said that, you know, staying open to it because it's not an exact science. And that you as a patient actually appreciate when your physician comes to you and says, you know, let's look at this. Or when you can proactively go to your physician and say that. And that's a helpful thing as the disease moves on.
That is.
Yeah. So Holly, do we have any questions?
I do not see any questions in the panel right now, but if there's something that you would like to ask Lionel or ask Amelia, please feel free to go ahead and type those questions in the box right now.
Okay, or anything you or Kirby?
Well, meanwhile, I wanted to bring up something we were talking about before we got started as well, and that was this concept of if a physician records a diagnosis of hereditary dementia or Alzheimer's, it can be a problem for you as the patient related to your insurance. Did I get that correctly? You talk about that a little bit?
Once it becomes, if you look at insurance and someone puts down that my dad had Alzheimer's, you're going to have a tough time getting life insurance. Even, I mean, if it's on the record that my dad had Alzheimer's, I found that I couldn't get long-term care. I get life insurance for my long-term care. But when you add hereditary to that, then it's on the record that my kids have 50% chance. In my situation, my kids have 50% chance if it was hereditary ALS, and I'm talking a different disease, I know that, but they'll never get health insurance if they go out in primary. There's just a lot of limitations. So what you put in your records is really important as doctors. That's read by people. Now, if you feel that that's the full diagnosis, you don't have to step back from it.
No, if they know it's correct and accurate. But if there's some question as to whether the parents really had that diagnosis,
yes,
it's best for you if that's not included.
And if you look at a diagnosis of Alzheimer's, make sure that you've had the neurological tests and the social tests done by the time you put in your records, rather than put in your records and then send them to your neurologist, because once it's in your records, insurance companies. I used to sell long-term care insurance.
So you have perspectives from both sides of this.
And I know we turn people down left and right if they had this kind of things that were family oriented many times. So be careful.
Yeah, that's a really important aspect to documentation that I certainly never considered before we had this conversation.
Well, and I think that one of the things we advocate for at the Alzheimer's Association is understanding the 10 warning signs of Alzheimer's or dementia or something else happening. And I think that you've shared with me that you were the one originally who noticed things were not right. But because of your knowledge of insurance, you actually went to kind of an anonymous memory clinic, not clinic, but health fair.
I did.
At the local college or nursing home even.
Really what I did was the Community College of Cape Cod just had a little ad in the paper that said, we're running memory tests at such and such a location. It's private. And so I went in there, and there was students learning how to do the memory test, but the memory test didn't go anyplace else. So anonymous way of handling it is a good way, and that wouldn't be what doctors would.
Sure.
You know, doctors don't. You know, you don't want to end up having people make wrong choices.
Of course.
I'm not encouraging that, but I found it really useful to at least find out a little bit from that memory test, and then I went ahead and went to a doctor. I went ahead and went to whatever it's called. The next guy up.
The next guy up. Well, and it just goes to show you that people may come to a doctor's office in many different ways and for many different reasons. And sometimes we hear that families are the first to notice something's wrong, and the person with dementia says, no, I'm fine. Other times we hear a story like yours where you noticed before anyone. In fact, you had to talk your wife into the fact that something else was going on for you.
I think many times your helpmate or your wife, they don't want to end up thinking about Alzheimer's or dementia. So when you tell them I'm starting to have memory problems and you might go this way, it's something that's kind of shut down quickly.
Yeah, people may not always want to know.
Yeah.
Absolutely. And so thank you so much, Lionel, for sharing your time and sharing your true expertise with dementia. And thanks for being an advocate for the 5.5 million people out there living with dementia.
Well, thanks for the opportunity.
And thanks, Holly.
Thanks very much to you both, yes. And to everyone who's been online here, I have just a couple quick housekeeping items for you. Just a quick reminder that this will be online on Monday, so if you want to look at it again, just go to the website. We've got so many great things for you there, including those rapid referral forms. Here it is again. As Amelia mentioned, this is such an easy way for you to just ask permission from your patient or the family to make a referral. Really quick form. Dr. Murphy actually even had the already brief form abbreviated even further for our MESA audience. So it's a very simple thing for you to do. So we hope you will use that. And that is it for us today. I want to thank you all for participating today and throughout the past 5 years. Feeling just a little teary-eyed right now as we wrap this up. So best wishes to everyone, and we're out.